Hi, welcome. It's Matthew Holt. This is THCB Gang, episode 45. It is March the 4th, 2021, and I have a fine lineup today. We were kidding around, rescued earlier from the total unity of Y chromosomes by Denise Pines. So who we have today? Well, Denise is the chair of the California Medical Board, also runs the company T Botanics. She'll be a consumer expert. Used to be the brains behind the Travis Smiley Show for many years. Also on the lineup today, Michael Millenson, President Health Quality Advisor from Chicago, patient safety expert. Kim Bellard, frequent THCB contributor, now crypto guy, after his wins today. Mike Magee, medical historian, who's been a regular on THCB pages lately. And Vince Kuraitis, who hasn't written enough on THCB, but is a consultant, a health policy analyst, and expert on all things concerning tech and technology and healthcare. So here's the gang for today. Looking forward to the conversation, and let's start around. And it's been quite a week. There's also finally some healthcare stuff in that bill. So who wants to start off and tell us what they're busy about this week? Or do I have to pick someone for the crowd? I see no movement, so I'm going to pick on Michael.
So, of course, COVID vaccines, and we're going to get them out by May, and the expansion of the ACA. Now, I think that before you get your vaccine, you should sign a consent form that says you realize it's provided by the federal government, and that before you get your expansion of health insurance, you sign a consent form saying you understand this comes from government action and that ACA is otherwise known as Obamacare. And if you're not willing to certify that you've been saved by the non-private sector, you have a little next of kin form you can fill out. So I think those are our big moves for the week.
That's bound to work, Michael. We will just make sure they keep your federal government out of my Medicare. That's the important.
Exactly. Well, you know that and this is without any irony at all, that it's the governor of South Dakota who was pleased to be invited to CPAC because it's not. I'm North Dakota because it's not in North Dakota. Declared that the COVID-19 was a problem not of the epidemic, but the problems were caused by the government. This is with a straight face. And so, I think that kind of serious delusion needs to be met at some point by serious reality checks, although I'm not sure that'll ever happen.
Well, we'll hope so. I did listen to something on NPR about cult deprogramming, in which they had an ex-Moonie calling a QAnon person. It was
that's great.
Quite interesting. Kim, what have you been looking at? Tell us about the crypto as well.
Oh, you can read the article. I'll talk about something else. I'm just amazed by what's going on in Texas. We have the Governor Abbott magic show. First the power outage was caused by the Green New Deal. Then to avoid people thinking about that, we're open for business 100%. And then he said, well, any COVID we get though is because of these immigrants that the administration is releasing at the border. And then we discovered that the administration has offered to test all of them, and his administration is not agreeing to that. So he's going to run out of magic tricks at some point. We're going to see the rabbit.
Denise, what have you been looking at this week?
I've been looking at schools, the debate in California around schools and when are we going to open the schools up? You have the teachers and the teachers union not wanting to open up schools, and you have the parents wanting to open up schools and the students wanting to open up schools. So the legislators are meeting today to decide what is actually going to happen. And so, unfortunately, our governor looks like he might be losing on this issue.
Well, it's just been remarkable to me that in San Francisco, the mayor is actually suing the school board for not having an opening plan. They haven't been back at all. Where I live up in Marin, just one county north, most schools are back with teachers in class 4 days a week and students splitting the class. And it seems to me that, if we have enough vaccines to get the whole country done by May, how we can not be talking about doing a full return to school next August and beyond me. Another year out from school for those kids is going to be terrible. So,
exactly.
Plus, I want to get my kids out of my house. Let's be honest about what this is about. Vince.
Yeah, we've seen a lot of big tech in healthcare in the last couple of weeks. I'm going to comment and just put on the radar screen one that I think is particularly interesting and worth watching. Last week, Google gave a formal name to a project that they've been working on for quite a while. It's called Care Studio, and it has the potential, I think, to shake up what has traditionally been a very I'll use a polite word, ossified electronic health record market for delivery systems. What this product does is it essentially sits on top of existing EHRs, and it pulls data from disparate EHRs. It organizes the data, and with Google's artificial intelligence, then offers suggestions to the clinicians on what to do, but leaving the final decision up to the clinician. Not without controversy, the project was actually revealed about a year ago. You might remember the Wall Street Journal revealed an article or revealed the existence of this project. It was with the Ascension Health System, and internally it was called Project Nightingale. And what was particularly controversial about it is that they were using patient-identified data. So it's really a case of where we have to trust Google as a business associate. But the headline, just to repeat it, I think is this has potential to shake up, not in the short term, because the lock-in is so great with EHRs. You buy an EHR as a hospital, you expect to have it for 10 years. But it's worth watching in the long run to see what these companies can do. And it certainly, I think, has the potential to improve clinicians' experience with EHR. So that's my item of the week, Matthew.
That's pretty interesting. And actually, there's a company called Innovacor, of which Jonathan Bush of Athena Health Infamy is on the board, which does kind of the same thing. That's also raised another 100 million last week. So there's a lot of this sort of EHR level on top of data and analytics plus data.
Vince, if that Google product gives them suggestions, that would say that Dr. Google has now come to the doctors.
Okay.
I'm sure that's a joke, Michael.
That's a fair observation.
All right, Mike, it's you're going to round off the lightning round.
Yeah, Matthew, I had a moment of deja vu this week. It reminded me of when I was an active surgeon, and I had a historic long fuse in the operating room. It would take a lot to get me angry. But if things were going bad long enough, I'd always sort of give a warning, and it would sort of go like, in 5 minutes, if everybody doesn't get their act together, I'm going to go nuts here. And I sort of felt that that's the signal that Biden sent with his Neanderthal remark this week.
Right.
He basically was signaling that he's got a long fuse, but his patience is not unlimited. And having grown up in a similar set of circumstances that he did, I may be 5 years or so younger, but parochial school, small town, tough kids, school ground bullies, having to stand up for yourself, but generous in spirit up to a point. That's what I think that Biden is. And I think what we may see in the future, if he keeps getting pushed the way he's getting pushed, is that, and he may be doing this deliberately, he may be simply being reasonable up to a point where he gives everybody plenty of rope. But I think he's getting closer to the point where he may flip this whole thing, and it may present itself in a different approach to the filibuster, or an expansion of Medicare, or pulling the plug when it comes to the voting rights bill that's coming up. But I think people may be mistaking that this guy is going to have unlimited patience. My feeling is that he may understand exactly where he is and know exactly when he's going to pull the plug on this thing. So I'm expecting bigger things to come.
What do you think? But regarding the actual Neanderthals, which is the governors of Mississippi and Texas,
Right.
Although I think somebody like Nikki Haley or somebody was out there defending. No, one of the Republicans, female Republicans in Congress, was defending the Neanderthals as being very successful. And I did point out that they're extinct, so you don't know how successful they are. But I mean, what could he actually do about those states? Because that's a lot of that power's at the state level, right?
Right. I mean, at the core of our system of government is the disunited United States. That's how it began, and that's how it's remained. But the truth of the matter is that when it comes to substantive improvements in quality of life, there's very little you can do without national standards and national planning, and you create tremendous vulnerability. Now, what we've seen with education, which I think Denise is right, this is like the hugest issue right now. And what's interesting about the issue is that tech is coming in and almost creating a national umbrella around these disunited United States by virtue of transparency and revealing the states that are lagging, and also advancing standards that can be easily adapted at low cost across the nation. So I think, one of the tricky things here is exactly what will be the long-term impact on social capital and time horizons and work and workers delivered by technology.
Well, we'll dive into that in a second. Let me end the lightning round, which is it's been a long lightning storm at this point. Which with a couple of comments about things that I noticed this week in the digital health world, or the health plan world. Oscar Health finally went public. Was going to go at $39 a share was the price. They priced it above the top of the range because most IPOs have gone crazy lately. Kind of unlucky they priced it into a week where there actually was an up day and then a bunch of down days since. But again, they raised 1.4 billion, I believe, which is quite a lot in the actual round to raise is in the actual IPOs, new cash infusion. Now they've been losing $400 million in the last year and 250 odd million the year before, so it might take them some time that gives them some more runway. Since they went public, the stock is now trading the 32. So, but they're around, still a market cap of around 6.5 billion for a company that's been, albeit growing fast, losing a ton of money. And meanwhile, Clover, which went public as a SPAC, the Medicare plan, has been under real pressure from short sellers and is down now below where it went, where it SPAC'd out somewhere in the $7 to $8 a share region. So, there's a question as to whether this week, maybe the deflating of the big stock market bubble and what that means for some of the hundreds of millions of dollars that have been coming into the health tech sector. Having said that, there was a big deal this week also with between Google and Highmark, your old friends there, Kim, about building something called Live Strong, Live Alive, Live Healthy, something which was going to do something with Verily and Google Cloud. We'll figure out what it means later. And there was a couple of $100 million for one of the at-home healthcare companies, Dispatch Health, just recently. So there's still a lot of money floating around trying to figure out where it's going. We'll obviously see how long that lasts, given how the public markets go. But the brief headline is that we now have some of these startup health plans have raised money and are real, and are on the stock market. We're now going to really see how they perform when they come out of that kind of level of public scrutiny. So with that, I'd love to dive back into to some of what we raised. Let's start with the sort of.
Can I comment on what?
Sorry, go ahead.
Comment on what you said.
Yeah, please.
When Oscar showed up, I think it was around 2014. What they were doing was actually pretty innovative. They were building a platform for patients to make it easy to interact with the health plan and with the health system. What I don't see today, though, everyone's doing that today. The health plans are seeing that telehealth is something that gives them the ability to control the digital front door, and everybody's doing it these days.
Yes, Cigna, right? Cigna just bought MD Live.
Yeah, they did
last week, which is one
I
of the
think
biggest health companies.
I just don't see what's unique about Oscar anymore, and we truly, as a world, are awash in capital, and this is Exhibit A.
Maybe they had to get their money before the people realized the emperor has no clothes.
Well, look, there's a lot of that in general, right across the health system, right? People especially in the stock market as a whole, people raising money. I'll tell you my funny joke, which isn't that funny, which is that I was sitting around going, oh, I've been poo-pooing too much of this stuff, and all these people have been making money on Wall Street bets, and I found a company with stock ticker THCB. So I thought I better put a bit of money into it. I'm down 20% this week so far.
You should sue them.
So don't just buy something because it's stupid. Doesn't mean it always goes up. It's some kind of electric battery company. I'm sure it'll come back and be huge later. All right. I wanted to dive in a bit to Vince to talk a bit more about what you were, what you were discussing in your piece. So say a bit more than you were, and obviously it's related to the Oscar piece, but also about sort of telehealth being a commodity. But just say a bit more, and let's take us down that path a bit.
About the Google piece, or about the Oscar?
About the Google piece, and about the sort of integration of where that's going in terms of the integration of data across systems. Yeah.
So healthcare organizations, hospitals have not been particularly easy to work with. If you got something innovative, you look at an 18-month sales cycle before, and then they want to pilot you to death. And electronic health records also have lots of issues. I mean, clinicians hate them. The user interface is lousy. They kill people. No one likes to use them. And yet we've had, very, very consistent market share. I mean, there really aren't very many alternatives. Capitalism is not working in the EHR market. And if you look outside of the outside of the US, what the really interesting movements that are going on is EHRs are being built on open platforms. Go read about open EHR, and they're standardizing it all. Epic has not had a history of being a very open platform. That may be the understatement of the week. And to give them credit, I think they're trying to work it off, but they've got a lot of culture. So what I see, and this is not a cheap, Google spent a lot of money on this, is and my sense, frankly, is Google's been motivated more clinically than by business means. But it certainly has a lot of business potential to shake up the EHR market. Again, it's being built on top of the existing EHR. It pulls data from disparate EHRs. It displays that data, and the product that they're now formally calling is called Care Studio. So Google that, and you can read about it. There's an extensive blog article describing it, and a very good video describing it as well. And as they describe it today, it's really meant to augment the existing EHR. But if you take this to its logical extreme, there's no reason where Google could take over the interface and be the primary interface for the electronic health record. And then you begin to commoditize today's existing EHRs. Prices go down, and maybe we have some more options in the future. So those are some of my thoughts. This is going to take a while. I am working with a couple of platform expert colleagues to write an article about this. So if anyone wants to kick it around, I would just love to hear from you.
Vince, I'm not clear. Who pays for this Google service? Do the hospitals do it? Does the EHR do it? Who's buying it?
To be determined.
That's
Dr. David Feinberg, the head of Google Health, the division of Google that's working on this. And just another, by the way, Google has investments or ownership interest in 57 different healthcare companies. I mean,
right.
A lot. David Feinberg said if he got from the orders from Eric Schmidt, don't worry about making money. So for right now, there's no charges that are visible. And given Google's model, it may be a freemium product to be determined, but it's a great question.
I love the idea of not having to make money. I want someone investing in me on that basis. Just
nice to have that as a luxury.
Yeah.
Michael, and then I have and I'll come in.
So I did a piece about a year and a half ago about Google infiltrating medicine, where I started to look at the vertical of Google, which most people don't, right? They look at the cloud here or the Google Health there. And when you start to go from DeepMind and all the rest, you see that they're very deeply in vertical. And I thought what you said was great, Vince. So two things about the EHRs, which is, first of all, hospitals a couple things were forced into them through high tech, and before they were just for billing. And that's part of the reason the interface is so poorly. And they're so poor that if you go to see your doctor with the Epic record and you said, you know what, I hurt my shoulder and now it's hurting again. Can you find what you did last time? They can't search, right? They have to know, when did you do it? So that kind of very basic kind of thing that you would get from your 64K computer back in the 80s, they can't do on the record, right? So it's just terrible customer service by them. And then you add on top of that arrogant behavior, where if you have, 3 hospitals that all have Epic and they decide to merge into a health system, but they're different versions of Epic.
They can't share it, data.
You can't share it, right? So you have incompetence plus arrogance plus ripping you off, right? And so you're just asking for somebody to come in and say, well, let's do something where, I don't know, you could search the way, you could and do other things. So I think it has a lot of potential, and maybe they'll get Geisinger, David Feinberg's old stomping grounds, as their first paying customers. I think it's a great development, and does speak to, Google infiltrating all aspects of healthcare in a way that people have not appreciated.
But
There are a couple of things that I just worth adding. So I mentioned briefly Highmark, which is the health plan in Western Pennsylvania, but also bought a bunch of hospitals. Bought any hospital that's not got a UPMC logo in front of it, right, in Pittsburgh, ended up in Highmark as well, somehow in the mess. And there's a great fun story about the competing CEOs, and one of them who showed up at his ex-lover's house or whatever, had a fight. Wow.
The mistress, excuse me, he showed up with his mistress, I believe he was trying to shoot her ex-husband, and they fired him. And his lawyer said, and God bless lawyers, his contract says that he's fired for a cause. And he's been a great CEO. There's nothing about showing up with your mistress and your ex-husband in the middle of the street. How unfair can you be? And I believe they said,
I hope Kim Bellard, I hope he got a huge settlement. Anyway, but in the deal, right, with Highmark, so they're going to invent this new thing, which is called Living Health. I went and looked at the press release while we were waiting. Right. Unclear what it is. It's going to have a bunch of stuff from Verily. Unclear what that is, but around, and actually, when you looked at the Highmark press release, they didn't mention Verily, or they didn't mention Onduo, which is the sort of Livongo competitor that Verily is, the Google /Verily /Alphabet Sanofi spent a whole bunch of money on it, and clearly would have been better off buying Livongo. By the way, I've got a Livongo sweatshirt on because that's all I got out of Livongo, but that's by the way. But having said that, there's a couple of things going on, right? So one is that Google is desperately trying to get into the cloud business, where it's number 3 behind Amazon and Microsoft. And, the Google Cloud is doing whatever it can and cutting whatever deals it can to eat into their market share, because that's clearly getting Amazon Web Services is a massive business. Google's behind in that, wants to get ahead. So it's unclear as to how much of a deal they cut when they go to somewhere like a Highmark and say, we'll put you on Google Cloud and we'll give you this other stuff, which may cost money or may be free. But there's a lot of that sort of market share, land grab, and a lot of stuff gets to be cheap for health plans and hospitals in that. And that may, I think, Vince, be happening in the Google Studio thing as well, with Ascension and others. We don't know.
I'll remind people, a year ago, Epic, the HR dumped its deal with Google Cloud. But didn't Cerner start one up with Google Cloud at the same time? I think. I don't remember. Epic's statement was, they're not, our customers aren't interested. They're not big enough. Of course, Google is not a big enough company to work with. And, there were those of us who speculated that maybe they were figuring out that Google is a competitor.
Well, there is that. But don't also forget, right, that you're in a long transition here, which takes time. I took myself to put on stage many times, which is
5 years.
Which is that exact transition that we're going from data centers, in the basement of the hospital, which might get flooded if there's a hurricane, as we know happened in 2005 back in Louisiana, all the way through to nobody else in the world now, steadily all that enterprise technology that sits in your own physical buildings moves to somebody else's cloud platform. And that's why Amazon is growing so. It's not just the startups. It's also, the big enterprises are moving their technology and their services onto Gmail. It was about, 8-10 years ago that Genentech moved from, whatever it had on whatever its email system was using, just to using Gmail. And that eventually was one of the first big things like Google Suite, which is now a real thing that is a real enterprise technology platform that's used. And that's kind of the way the world has gone, and healthcare is starting to catch up. So, and I think a lot of the issues that happen when you tend to have these big cloud enterprise systems, yes, you can do a lot of different things on them as different companies, but in the end, you're more likely as a software vendor to have one deployed platform rather than the Epic style of having, a bespoke platform with lots of integrated niche, lots of bespoke niche order sets and what have you for every different hospital. And that, leads you potentially to get some standardization across healthcare, which, hasn't, as we know, hasn't happened. I mean, Michael can tell us at length about practice variation and safety standards varying and God knows what else. So, I don't know if that's a real thing, but you've got to imagine that it was starting to be on the front edge of that. And it's going to be harder and harder to maintain all these different variants of Epic or what have you, or Cerner or anything else, as you move to the cloud platform.
Well, the EHR as a proprietary controlled kind of product of the healthcare sector, I think is very vulnerable and seriously undervisioned. About 10 years ago, I was with a couple of people, one of them from Google, one of them from Ancestry.com, and a few others. And their vision of a EHR was more like a lifespan planning record. Mm-hmm. And it extended from before birth until after death, and it integrated 5 generations in a family. And it included planning for education, planning for safety, planning for health. It was about living a full, complete, healthy life. And that was the platform they thought would eventually take over. Now we're 10 or 20 years later, and we obviously haven't gotten to that point. But if you were going to build something today, if you were Google and your partner was Ancestry.com, you wouldn't be thinking about how to move data between hospitals. You would be thinking about how to integrate health data with all the other important data that people need for, a full and complete life. So I just think the vision needs to really be ramped up. It's, to me, it's small, it's tiny. I know that's where the money is, and I know that's where the money has flown from, but it's a tiny vision to think of a technology platform that would help you live a better life and restrict it to what happens between a hospital and an outpatient healthcare unit. That to me is small.
Mike, what do you think of the, when you, and I agree with you, it's on vision, but also where the money is. So now add in open notes and information blocking regs and some of the APIs out there that now will allow you to do exactly what you're talking about. Right. And what happens now?
Well, what are we missing in this country? We're missing a plan, both on the individual, the family, the community, and a national level. And so one would have thought that technology would have moved into that space big time, but you don't see a lot of planning. What you see is a lot of data sharing. And so I think there's a huge opportunity still for something that is useful on a family level to help, supermom, all of the different multitasking that needs to be done. I mean, and if anything, this pandemic has illustrated that, if you're forced to all be within the same 4 walls and you've got to make it all work, you're going to need technology big time.
Hey, let me off.
Okay, let me kill the conversation on that one because I want to move on. I want to go to what Denise started talking about, which was the school openings. And Denise, I know you've been following that pretty closely. So tell us where you think we are in terms of the sort of the vaccine role. I know you've been looking at that in California. What you know about where we are in Southern California. I have some hints about Northern California, and perhaps we can go around. But give us a sense of where we are and where you think the both the process and the politics of school opening is for now, because I think that's the one of the biggest issues which we're going to have to deal with in the next few months.
Yeah, I mean, we've got a couple complex issues here in this state. I mean,
Sure.
Today actually marks the 1-year anniversary of the governor's declaring a state of emergency on COVID, right? And but we still have 87% of our state population in the purple tier, which is the worst tier, right? The color that's designated as high risk. And, as a result of us not really being able to figure out the complexity of this state and we figured it out with getting people tested. We haven't figured it out in terms of getting people vaccinated. And we are finding that if you're wealthy, right, you can get vaccinated. But if you're the high risk population that's contracting the virus the fastest and dying from the virus, you can't seem to get the vaccine. And so yesterday or Monday, I believe this happened last night, where the governor, the administration has designated that the priority now, 40% of the vaccines are going to be earmarked for 400 zip codes. Largely, these zip codes are in Los Angeles, the Inland Empire, which is further south of LA, and then Central Valley, sort of, I guess, like that Fresno area, more of the rural sector of the state. And this is a result because of what I said before, is that, people of color, Black people, Latinos, who are hit the hardest, have not been able to, or find themselves mostly in the hospital, have not been able to have access to the vaccines. And now that also mitigates the fact whether or not they'll take the vaccine, because you still sort of have that issue around communities of color and trust around this vaccine. But still, taking the trust issue out, they still don't have the ability to actually get the vaccine. So that's where Blue Shield has come in, right? Not necessarily particularly on this issue, but on the issue of complexity and this state not having the ability to speed and streamline the rollout of the vaccine. And so even though there's tons of questions on the why Blue Shield, I mean, even my mind was like, why Blue Shield? Why can't the state, why can't the government do this? I mean, what we're finding is that, we have 41 decentralized systems trying to actually get the vaccine, and of which some are sophisticated and some are not. And I think it was the way to actually just centralize this process and have one entity to actually go to deal with the communication to everyone else.
So I saw that announced last night by Blue Shield. I actually went on the myturn.ca.gov website.
Yeah.
And I pretended I was a 65-year-old plus to get my vaccine. And the nearest vaccination center to me is down in Oakland. There was some stuff they need to work on. So it's at the Oakland Coliseum, which is a big baseball stadium.
Yeah.
Didn't say that. It said, Coliseum Way. You might didn't. And then after you pick your first spot, which was tomorrow, whenever, it automatically gave you the option of picking 21 days later. But it didn't actually explain why you had to come back. So, I mean, I guess most people know there are two doses for some of these ones. But I think, there was some UX to be done on the side. I don't know whether that was Blue Shield's side, whether it was Accenture's side who did that. There's been a lot of back and forth about vaccine schedulers and public sites and the thing that Deloitte built for the States, which didn't work. And then some other potential replacements. And there's a lot of back and forth about this. I've been involved in that a little bit, running a process for an IP in upstate New York, which still hasn't figured out which one actually wants to get. But a lot of people involved in that. Doc's got one of these things, and there's been all this going back and forwards. And then the joke was, after I was all the way done and went to hit, reserve, and this was about midnight last night, it gave me an error message and told me to call on the phone number.
Oh, way.
So, so I couldn't even, I don't know what I've done. I've had to show up and,
That's terrible.
I had to steal on Michael's ID and pretend I was over 65 and actually gone through with it. But
so Matthew, with the Walgreens, and I'm scheduled with my wife for our second dose next week. They have something where, and it's just mind-blowing that, you know, for a large corporation, that you schedule your first, then you go to your second, okay? And it shows you, let's say that there's a Walgreens 30 miles away, and it shows you 8 times. You go, great. You pick a time, it's up there, right? And it says this time not available. And rather than not letting you choose a next time of those 8 it showed, it cancels your first dose and makes you start the whole process all over again. And so now, since remember, this is the lottery, so everybody's on their computer. It's like trying to get Cubs tickets to the playoff, right? So now that
won't be a problem, I think, in the future, from what I hear.
Yeah, you've been canceled. Now you have to go back, rebook a first one that you can find, and then go again. It took me 6 tries on this to like get the numbers to line up, like, you know, and it's available. And it's
but is that one of the reasons? Coming back to Denise on this, do you think that's one of the reasons we've had problems getting access to, you know, communities of color? I've heard, obviously, that. I heard a rumor slash, you know, true, that of UCSF nurses, 30% won't get vaccinated, haven't received the vaccine and won't get it. So I've heard rumors that there's. I don't know if there's an anti-vaccine issue amongst communities of color and Hispanic and the African American community, or whether it's access because, you know, they don't have access. They don't have time like Michael to sit around and do it.
It's an access issue.
Yeah,
it really is an access issue. Like I said, you know, the now don't want to get the vaccine is also another issue, but it's mostly an access issue, a distribution issue, and then what is happening in South LA. So that people from sort of the west side are coming down to the south side to get in line and get those vaccines if people don't show up, right? So yeah, it's crazy, it's complicated. You know, my turn is still, you know, the place you have to go to still, you know, register in our state. It's not going to CVS or Walgreens or anything like that. So the state is still maintaining the control over the scheduling. And then that gets handed off to Blue Shield to make sure that, you know, the data that needs to be collected is collected from where those people actually go. But yeah, I think designating these 400 zip codes is really going to change definitely the outcome. And I think we might actually see now, if we get those particular vulnerable communities vaccinated, that we'll see a huge turn in the test rates and the, you know, that we've been seeing in the state and that we can't seem to get out of the purple. I mean, 87% of the state is still in purple. This state has 40 million people in it. So this is still a huge issue. People are still, you still can't go into a restaurant and eat. You can't go to a museum. You can't go to a theater. You can't do so many things still in this state.
We could just all move to Texas. And then we can do all that stuff.
Yeah, we could.
but seriously, I mean, I think Mike said this a few weeks back. You know, it wasn't Mike, it was Jeff Goldsmith. You know, we need to get to where we were in New York and when they did the polio stuff in the 50s, right? Get every school open, get people lined up, get ready to go. We also need to take advantage. I mentioned $200 million going to a company called Dispatch Health, which is one of the many companies just doing at-home health visits. We have a whole network of people doing at-home visits with home aides, training those people up, getting them out there and figuring, you know, going door to door, like the Census Bureau, getting into the community. To me, you know, because it's one of those things where it's on all of us, and it's certainly on the, you know, all the state, local, federal government. The sooner we get everyone vaccinated, the better, right? Because then we get back to normal. And by the way, once we're done with the US, and now we saw, so you were talking, Mike, about Biden banging heads, and he clearly banged the Pfizer and Merck CEOs' heads together last week.
You know, Ashish Shah and I have both been advising the new governor of Rhode Island after Gina Raimondo went to Biden's administration. And one of the things that opened it up in Rhode Island is to prioritize teachers. Sure. Because once we prioritize teachers, what happened is the schoolhouses opened up as vaccination sites, which is critically important for underserved populations and at-risk environments, because that's one of the few infrastructure settings that feel safe to Black and brown communities in these high risk areas. And so once that happened and the teachers understood that they would be expected to get vaccinated, the rest streamed in behind them. So if you look at Rhode Island's numbers today compared to a week or two ago, they've captured up with Connecticut, and it's all based on opening up schools and getting teachers vaccinated.
Just the last thing on the numbers. I looked at the UK numbers, which were just out yesterday, and they're super high. I mean, some area, people above 65 is like 95%. Where they are, I'm still a bit worried though, was where they were, and even NHS frontline workers was in the high 90s. Where they were down and was concerning was their care workers, their equivalent of, nursing home aides and care aides going to the home. They were still even the UK, those folks were still in the 60s and the 70s, whereas I think nationwide they are, apart from the Israelis and the United Arab Emirates, they are of the big industrial nations. The UK is far ahead. It's in the 60s and we're in the 25s. If you look at the rest of Europe, it's like
Matthew, they've made a big bet about the first and second doses. I mean, they're still doing like 12-week delays in the second dose, and that's a big bet. And there's no evidence that that's going to work. So they're rolling out.
But then don't forget, the easiest to make and easiest to distribute vaccine, which is the J&J one, which is just coming out, which, as I was mentioning, Merck is going to, I assume they got a call from the CEO got a call from Biden and said, you're going to make this. And don't screw. But not, the other thing I'd point is, even if we get everyone done by May, that's great, fantastic. We have a country north of us called Canada. You may have heard of it. It's in the single digits for having vaccinated people and seems to be struggling. We have a country south of us called Mexico, which you may or may not know does a lot of cross-border trade with the US, which is, again, struggling. We've got to get those vaccines out to everyone, because if this pandemic taught us one thing, it says that there is no such thing as a localized pandemic, right? Once it gets in one place, it gets out.
So Matthew, we're still recovering from the disinformation presidency, right? And if, what Israel and Britain and a lot of other countries have in common is a sense of social solidarity, right? And if
I'm not sure the Brits have got that anymore. They just went through the 4 years.
And actually, the difference between Boris Johnson and Trump is that Trump almost died, but refused to let it go public and didn't change what he said in public about the virus, right? He refused to let reality get in the way of what he said, whereas Boris Johnson changed his tune, right? And so if you have not only our system of government, but no social solidarity from one group of people, and then another group of underserved people who are scared of it, and you have no consistent message, where do you go? So I got an email from a colleague today that the ad council and people like that are just now starting to get together the ads that will sort of have, people you trust telling you to get vaccinated and all the rest of that. So we're doing this, but we're trying to create any sense of social solidarity really late. Right. And in a country that doesn't do well with anything but individualization anyway. And we're reaping the consequences. And to go from that to care about your neighbor, I mean, it would be great if, Christian fundamentalist leaders, religious leaders of white Protestant churches, were an advertisement saying, love thy neighbor, wear a mask, right? To the vaccine. It would be nice in the Orthodox Jewish community if that same message came, right? But we don't see religious leaders stepping up on this. We don't see civic leaders stepping up from all sides of the spectrum. And so we have what we have. And to me, frankly, it's shocking, but I guess we shouldn't be shocked by anything anymore.
It's a great observation, Michael.
New Orleans just went
right
against.
on.
Sorry, Kim, say again.
The Diocese of New Orleans just went against the Pope
Right.
and said they can't get the J&J vaccine because it has something to do with abortion stem cells. So, I mean,
Right.
What?
the Catholic Church isn't even following its own rules.
Oh my word. Well, you mentioned social solidarity, so let's move on. So, actually, no. Before we go, Denise. So, when are the kids in it? Forget my kids because they're back in school because Marin County is its own world. But
Right.
my colleague in Ushuaia, her kids in the Los Angeles School District. When are they going back to school?
We don't know yet. They're still in, the legislators are supposed to be voting on that today.
All right, and the choice is to open up or to sort of. What I heard about the teachers, was some of the teachers unions. Some of them were suggesting they want to wait till the kids get vaccinated, which I don't think is practical. But I don't know if that's true or not, or just a rumor I heard. But I may be spreading disinformation, which I be careful about on this show.
I think there might be a little disinformation. I think what they're trying to do is look at prioritizing teachers and teachers sort of falling into that group of the 400 zip codes, that adding the teachers into that group as the vulnerable group, and to get teachers vaccinated as a way to open schools up as fast as possible.
Absolutely, and I know that my friend's a teacher up here in Marin County is just, again, she's on that list. But again, they by the way also had to go through the hoops that Michael went through. They had to go on the CBS website, the Mike website or whatever website, and figure out where to get it. And then one of them found out and told the rest of them in their school. And it's not like I want it to be delivered to the house. Look, I want the UPS driver certified to vaccinate. So when you come on the post office, look, and when they come round, you're here in the home, you're a teacher, boom, let's get you done, because there's and I think Andy Slavitt and others doing a great job here focusing the mind. But clearly, this is the most important thing. And as I said, after that, we've got to get it to every other country in the world. Anyway.
Yeah, I forget who it was that said that schools are really the best places. And when you really think about how schools are designed around communities, or how communities design around school, however you want to look at that, it really is like the best place to actually hit people, because there's not a CVS or a Walgreens or a Walmart or even regular grocery stores across all communities, right? But there are schools across all communities.
And they're used to voting there.
Mm-hmm.
Right, exactly.
They're used to voting there, yeah.
So talking about voting, we had an election last year, you may remember. We have a pandemic bill that's passed the House. There is some stuff in this. I know we've talked a bit about this before, but it's getting closer to being real about what's in that bill. There is some money for for more premium subsidies. There's more incentive. There's money for incentives to states to expand Medicare. There's some money for subsidizing Cobra. Sorry, Medicare. Sorry, Medicaid. Thank you. I can't believe I've only been in healthcare 30 years, and Michael's now pointing out there is a difference between Medicare and Medicaid for me. So good that I'm learning that eventually. What's a sense? I don't want to take this. So what's a sense about now? We have the issue that there are things that are going to make it. The Senate is very easily poised. We have at least 2 Democratic senators who are acting like Republicans, as far as I can tell, in terms of not wanting the $15 an hour minimum wage or being concerned about the filibuster or what have you. What's your sense? What's a sense about what is going to make it in this bill, which is probably going to pass presumably in the next couple of weeks, even if I believe Ron Johnson is reading the entire bill word by word into the Senate record to delay it. But once that's all done, what's our sense about what emerges in this bill in terms of real focus for Obamacare, for the ACAs and the rest of it, so that Michael can have that stamped on everyone's sign-off sheet when they get their vaccine, versus what might come later, if anything, in terms of expanding Medicare or expanding or the public option. Anyone got any views on that?
I mean, this is it, right? This is the vehicle, right? I mean, everybody's learned that, first of all, the country does not care about healthcare as much as we do, right? Give some expansion of access, and this is where you do that. And that doesn't mean that there won't be other bills where you can look at drug prices, although everybody loves drug companies right now, or you can't look at some other kinds of things. But this is really it. And if you look at what is popular, what is always popular is giving money to people. That's always a very popular political position.
Apparently, the Republicans don't think so, because they don't want to give.
Oh, they give money to different people. They give money to different people. So in this case, one is to millionaires, the other is to people without health insurance. They're both people, and
equally deserving, surely.
So this is expanding access. And even the Republicans sort of know that's not what they're making a big noise about, right? So I think those provisions will stay, although because of the way they're done, they've got a sunset on it, right? Because otherwise they're not financial and all the rest of that. The thing is distressing. You mentioned Ron Johnson. I mean, I'm in Chicago, and so we're very close to Wisconsin. If you look at the demographic makeup of Wisconsin, with Madison, with Milwaukee, there's no reason that Ron Johnson should be such a hard right, anti-whatever guy that he is. And also given the tradition of progressivism in Wisconsin politics. But it just shows some of the divisions we've got, that he's not particularly worried apparently about being reelected in Wisconsin and can do these kinds of things. And it's just a shame, because his constituents, a lot of his constituents in the rural areas and in the urban areas, need this kind of help. And it's just again a shame that that's happening. But I think the healthcare stuff will stay, and I think all the fantasies about expanding Medicare and doing a lot of other things are going to remain fantasies for a while, given the political capital and where else Mr. Biden would like to put it, like with infrastructure and education and a few things like that.
We're finding out that Joe Manchin is more important than Bernie, and that's going to cause the Democrats to start to splinter. The progressives are going to get frustrated at the things that they can't have. And, one guy's determines whatever the Dems are going to do. I agree with Michael. This is it for a healthcare bill. Next Biden's got to.
Hey, Kim, do you think that Bernie would be more influential if he changed his registration to being Democrat?
No.
So, I mean, that's it. But you can argue back and forth. I saw a tweet stream today, which was saying, well, we think about these things, but go back a decade or 12 years to early 2009, when we had 59 and then 60 Democrat, 58 then 59 then 60 then 59 in quick succession Democrats in 18 months in the Senate, right? So we had a filibuster-proof majority. Actually ended up having to pass the House. Sorry, the Senate. The House had to pass the Senate bill because they lost a seat back in the seat was now Elizabeth Warren, small people, right? But if you think about it, the majority we were still at the time there of having a significant number of Democrats who are very right wing from conservative red states, if you like, and that's kind of been washing out and has continued washing out over the last few years. So the Senate is a particularly difficult body because it's incredibly undemocratic and unrepresentative. And yes, it should be abolished, if you believe me. I think states should be abolished as a whole, but I appreciate that's going to be a tricky political position to actually get affected over the next couple hundred years. But anyway, if you think about it, we now have a couple of very conservative Democrats who are potentially going to hold some of this stuff up, and the Joe Manchin's obviously one of them. Having said that, if you look at the data, at the polling, about 60% plus of Republicans are in favor of what's in the pandemic package. So, you've got to wonder, yes, the Democratic Party may be closer to factioning over this, but the Republican Party is actively doing that. Our former dear leader showed up at the CPAC convention and told the people the election was a cheat, and he was coming back and he was going to be hanging around for 2024. So I'm not convinced that there isn't some middle ground to be done if, as Mike said earlier on, Biden is being sort of softly working behind the scenes, but maybe not.
Michael,
remember now, this is a guy who has decades and decades of experience as a politician, at least as experienced as McConnell. 8 years with Obama and seeing what they did to him there. This strong kind of spiritual underpinning, and a wife who's gently patting him on the back to give him enough backbone strength to deal with the misery of the human existence. This is a guy who is unlikely to take all this lying down. If he sees himself as at a point where regular politics doesn't work, I think he'll probably act. Now, I could be wrong, but I think he'll blow the thing. I think he'll blow it up, and especially with things like voting rights. I mean, remember, Kamala Harris is his partner, and they're basically setting this up so that they can steal future elections. If he has to break the rules in order to get that voting bill passed, why wouldn't he? That's my view.
I want to reinforce Mike for a second, because we tend to look at things for some odd reason through a healthcare lens.
Why would we do that?
I'm not sure why, but I mean, I think this is exactly right. If you've got the political capital, that's sort of the key. There are certain key kind of things that the general public gets: the right to vote, some of the other economic stuff, with COVID. I mean, so I think Mike's right that you hoard your capital for what you can use. The problem with the voting thing, Mike, is that so many of the Republicans believe the big lie, right? And so they honestly, not the people in Congress, perhaps, who are cynical liars, but a lot of average Republicans believe that the election was being stolen. And when you go to the mat on that, what happens, which is a real problem. Just like we joked earlier, Matthew, tell the government to get their hands off my Medicare. I mean, it's a joke we make, but when people are absolutely convinced of that kind of thing, it has consequences for our democracy and for demagogues to be able to win re-election. And so it's really concerning. By the way, there's just an item that our former Republican governor in Illinois, you talk about rich people getting access. Our former governor of Illinois, the market-based Bruce Rauner, did a very market-based kind of thing about the vaccine. He gave $250,000 contribution to DeSantis in Florida so he could go to his second home down there and get vaccinated. Now, that's capitalism. That's capitalism at work. You see, Denise, if your underserved people in Los Angeles could only scrape together $250,000 as a political donation, they wouldn't be underserved anymore.
All right, we're going to go to Kim and then quickly Vince and Denise and then get out of it. Kim.
Mike, I don't share your optimism about Biden, because I think right now he's being driven by what the House is trying to pass, and they're passing a lot of progressive stuff that can't get passed in the Senate. He would have been more on what the Senate wants than what the House wants. So he's going to be forced to back further and further off, which is just going to weaken him in terms of, his support among the progressive Democrats. So he's going to be in a precarious position. I don't think the Voting Rights Act is going to pass. I think he's got to put some capital in the infrastructure stuff, whatever that's going to be. But even that's a tough sled to get 10 Republicans onto that. So I'm not optimistic about the next few months. I think this last bill is the one they got to put other capital in. And I think they put too much in it already. It's a Christmas tree that has a bunch of stuff in it that may not be needed, and certainly doesn't. Some of it doesn't have anything to do with COVID.
All right, Vince, Denise, we haven't heard from you two in a second, so a quick way, and then we're going to get out of here.
To go back to your original question about the healthcare provisions in the stimulus bill, what I'm not seeing, I think we've got pretty good consensus. The root problem in America is healthcare costs too much, and I'm not seeing a lot in this legislation that addresses that. So we're going to the trough and we're filling it up, but we're not really getting to the root cause here.
I'm optimistic. I want to be on the side of optimism when it comes to this administration. It's early still. I think they're still cutting their teeth. We're still seeing how they respond and act, and we don't really know that. I mean, we know that they're acting fast. They're making
very fair comment,
right? So I'm still optimistic. I haven't checked it off oh gosh, this is what the next 4 years are going to look like. So,
and I'd sort of weigh in and say I'd like to be as optimistic as Denise, and maybe I am. I mean, we don't know. We were thinking at one point that there was going to be an entire year of getting the vaccine out, and it looks like it might mean if we get our acting, if the acting's being got together the way they say it is, we might be done with that by the middle of the summer. In which case, there's time to do other stuff before you start panicking about the 2022 elections, which will, be along much sooner than we'd like them to be along, but will be along, and then we have to worry about the Georgia Democratic seat and God knows what else. All right, so we managed to cover the entire world, all the way from Google to school reopening to to the future of politics. What are we going to see in the next couple of weeks? Just going to go around the horn. Everyone, give me a quick soundbite on that. So I'm going to start with Kim.
Well, it is great that we're making such progress on the vaccines, and by May, getting all adults that want a shot, it would be great. The question is going to be how quickly can we do that before the variants start taking off, and will we have protection? And are people willing to go through these hoops now, and then again in 6 months, and then again a year from now? At some point, I'm worried that we're going to get tired of getting vaccines and we're going to give up on it.
Michael.
I think Kim's right to worry about the variants and all the rest. I think, there's a difference between our attention span for a pandemic and how long the pandemic is actually lasting. I mean, in 1918, they had a long attention span. They didn't have television. They didn't have the internet. We don't have the attention span for a long plague. It's just not in our nature anymore. So I worry about that. But I think, that bill going through Congress plus the vaccine starts to have some profound impact. And so I'll be optimistic for the next 2 weeks at least.
Vince.
What I've been looking for, all of your points are well taken. What I've been looking for has been data on how long do the vaccines work and do they provide protection? Can people who have been vaccinated still pass it on? There was a fairly qualitative article suggesting yes, that there's some protection in the Washington Post within the last week, but that's the data that I'm looking for, and I hope I'll see it in the next few weeks. I think that we don't know that. Until we know that. I'm going to be cautious, circumspective.
Denise, the next couple of weeks.
The immigration detention centers. There's 2,000 immigrants right now who have not been vaccinated, and 500 have tested positive. And right now it's in they're federally operated detention centers, and it's awaiting a court proceeding as to who's going to take responsibility. I mean, everybody's saying it's so complex. You know how we get behind that? It's so complex. What's complex about vaccinating people who are in a box, basically, that are scattered all over the place to vaccinate? So I'm looking to see how we actually solve that complex issue.
Mike, your next couple of weeks.
Yeah, my big thing is look behind the scenes. There's a hell of a lot going on in the middle of this pandemic and Trumpism kind of fog of war that's getting overlooked, whether it be a Moderna emerging as it has with its new technology, or change in workplace and work kind of patterns, or comfort now level amongst teachers with virtual education. Whoever dreamed that would have happened this quickly, but it's all happening and it's not going to go back. So I think the big news a year or two from now will be what we're not looking at. It'll be all the stuff that went on while we were looking at this other stuff.
Fair enough. Well, that brings us to the end of yet another THCB Gang. I want to really thank my colleagues who are on with me today. Kim Bellard, all the way from the wilds of Cincinnati, holding up, along with Michael Millenson from Chicago, holding up the Midwest end here. Is it the Midwest end or the Midwest middle? I don't know. Anyway, Mike Magee from Connecticut, and then spending fun times and games advising the folks in Rhode Island, really making an impact in the smallest state in the union. Denise Pines from Los Angeles, and Vince Kuraitis from the wilds of Idaho. I'm Matthew Holt. This has been THCB Gang number 45. We'll be back with THCB Gang number 46, which will be March the 11th next week, with a rotating cast of characters from the THCB Gang. With that, thanks for listening. Look forward to seeing you next week.